Time now for another Health Connections. We're with Dr. Mike Vance. He's the head of behavioral health at Children's Hospital and Medical Center here in Omaha. Thanks so much for being with us. We're talking about an issue that frankly is becoming more and more of an issue. It's eating disorders, right?
Correct.
And we're seeing that more and more. Why do you think we are?
Well, there's a number of theories, but social media and advertising a lot of focus on obesity as well as then has had less attention paid to those that are restricting.
Doc, as a parent, when and why should you seek help for your child?
Well, you'll typically see some unusual behaviors around meal times or around food, comments about body image, and another thing that you might see is unusual dressing or covering up, some restricting behaviors, really tightening on the types of food a person would eat and the amounts.
A lot of our viewers are in central and western Nebraska, but you can offer help to families from there as well, right?
We do. In fact, we're the only purely pediatric eating disorder partial hospitalization program within about a 4-hour radius. So we do get quite a few families from central and western Nebraska because the kids are in our program for about an average of 30 days. So the families come and stay in Omaha, at least one parent, because the parents are a huge integrated part of our care if we're going to be able to maintain the outcomes that we achieve.
Doc, what are some of the ages of the young folks that you're dealing with?
We see kids down sometimes as young as 8, but we found an alarming number of 10-year-olds that have been in the program recently, all the way up through age 22 in our program.
How effective is the program at really helping children get through this rather debilitating issue?
Our outcome studies are quite outstanding. We do a great job in doing gradual weight gain. We maintain the weight gain, and one of the benchmarks we look at is, do the kids need further treatment? In other words, do they have to come back?
Right.
And we have very low return rates. In other words, kids get healthy and they stay healthy and they don't need our intensive services anymore, which is a wonderful outcome for families.
What does a day look like when a young person comes in for some help? What's it look like in a nutshell?
It's pretty filled. The kids usually get here by 7 to 7:30 in the morning and they leave at 7 to 7:30 in the evening. And they might have as many as 2 to 3 therapy groups there, individual therapy, family therapy, consultation with our dietitians, our psychiatrist, and group therapy as well. So it's a pretty full day.
All right. Dr. Mike Vance, thanks so much for being with us.
Thanks.
That's Health Connections for this week.